Welcome to the Dr. Paul Show. I want to speak briefly about a condition called borderline personality disorder. You may have heard of the term. This affects, unlike narcissists, which are more men than women, this condition is more women than men. Borderline patients are people who they live chaotic lives. They have really difficulty controlling their emotions. They're way up, they're way down, and they're chaotic, and they're chaotic not only to themselves but to other people. It's different. I mean, I think it's different than like mood disorders because, with anxiety disorders, depression, bipolar disorders, these are treatable conditions. With borderline personality, in any of the personality disorders, and there's several of them, the problem is that it's a very ingrained pattern in the person. It's very, very difficult to change the pattern. These are people, like I said, you can spot them by the chaos. There's a couple books out. One is called Walking on Eggshells. And the other one's called I Hate You, Don't Leave Me. So if you think about the titles of the books, that's a typical borderline personality person. They're black, they're hot, they're cold. They lash out at you, and then they apologize and they're crying the next moment. They're just all over the place, and which is different than with anxiety and depression, where really the focus more on the mood. This is really more on a behavioral problem, and again it's very difficult to change. There is hope. Unlike narcissists who don't admit to problems and don't get help. There's more hope with borderline patients if they can admit they have a problem and they want to work on it. There's a type of therapy called DBT, dialectical behavioral therapy. That specific type of therapy, which is different than the cognitive behavioral therapy and a lot of the therapists who more common kind of therapies, this is a specialized therapy for people with borderline personality. A psychologist who's a friend of mine told me it teaches them how to be human. So it basically teaches them the basics of how to interact with people and how to keep in check with your emotions and try to get along and it's very extensive. It's a long-term type of therapy. It's not quick and easy. It's not cheap because it's you have to go for a while and you have to go often. So the problem is that most people don't do this. Most people don't take the time to do it, or some people can't afford it. And so, the problem with borderline patients is if you're involved in their lives, it depends on your involvement, because if that person is really affecting you negatively, you really probably want to stay away from that person. As sad as that sounds, because maybe you feel sorry for the person, but that person, like I said, is they're chaotic within themselves, and they will cause chaos in your life too if they can do it. And so, like I said, when you identify it, you just got to be careful with them and try to maybe keep a healthy distance if you can. Thank you for listening to this and for watching this. And if you have someone who you think might have borderline personality or who might benefit from watching this, please refer them to this. Refer them to my practice. I can help with this. I can refer them to people who can help. And also, with personality disorders, sometimes there are treatable conditions, because a lot of the borderline patients have problems with depression. They have anxiety. They might be bipolar. So we can treat that. And how I describe when you treat someone with a condition that's treatable, it takes away the rough edges of the personality. So, it's not quite as bad. The personality is not quite so abrupt anymore, where it's a little bit more smoothed out. It doesn't take it away, because medications don't treat personality. They treat medical conditions. But treatment can be helpful. It can be a step in the right direction.